So we're live, Dr. Thomas. Good morning, everybody. I'm Lori Werrell. I'm the Regional Director of Population and Community Health at MedStar St. Mary's and MedStar Southern Maryland Hospital Center. And I'm also the co-chair of the Healthy St. Mary's Partnership. First, I would like to thank each of you for attending our 2021 annual meeting today. We are excited to be able to offer this to you virtually. We're going to do some housekeeping, and we're going to keep our fingers crossed that the technology is kind to us this morning. So if you are viewing the sessions live, please post any questions at any time in either the Facebook or YouTube comment section. The session comments will be monitored, and we will answer them as time allows at the end of the session. If you are viewing this session recorded, please email any questions that you may have to the St. Mary's Partnership at gmail.com. I am pleased to introduce our keynote speaker of the day, my friend, Dr. Stephen Thomas. Dr. Thomas is one of the nation's leading scholars in addressing racial and ethnic health disparities. He is a professor of health policy and management in the School of Public Health and director of the Maryland Center for Health Equity at the University of Maryland in College Park. Please welcome Dr. Thomas.
Thank you very much, Lori. I am telling you, this whole Zoom world has been amazing as on the upside, and the downside is simply back-to-back Zooms. I'm just so glad that we're here today, and I'm able to talk with your audience about some of the innovative work that we're doing out in the community and how the COVID pandemic really has opened up both challenges and opportunities. So as we move along, Lori, can you hear me out there? Can I get a voice check on for you?
Yep, we can hear you, Dr. Thomas.
Okay, and then I want to make sure as we make these different transitions that the technology works. This is my first time on Yard. You call this Yardbird, right? Oh, StreamYard. And so I can't see the audience out there like we usually do in Zoom, but I'm hoping that you're smiling. And tell me if the chat function works. If I were actually having people make a contribution to type something in, does that function work?
Yep, so we'll be able to monitor those chats that come through. And when we go into a Q&A at the end, I'll just add them straight to the screen there, and you should be able to see them.
Okay. Well, I want this audience then to help me. I want the audience to think about a word that best describes how you're feeling right now at this moment in the pandemic. What word best describes how you're feeling right now? We're just going to take 30 seconds. And I don't want you to hit return, but I want you to type the word in, and as many words as possible, separated by a comma. Don't hit return. And I'll count you down, and then we'll all hit return together. So take a second and think, what word best describes how you're feeling right now at this moment in the pandemic? And we'll take a look at that, and that will help me understand some of what's going on with the audience out there. Okay, you ready? Keep putting those words in. Don't worry about spelling. 5, 4, 3, 2, 1. Hit return. And let's see. Hey, Lori, I don't see a whole lot of chat coming in, but at least it's in there. So we'll see where that information might be located. Oh, I may be looking in the wrong place. Okay, I see some words. Very good. So, very helpful to understand where the audience is, and I'm hoping that we get to an opportunity for some discussion. Thank you putting those words in. Impatient, grateful, weary, tired, and stressed. I think we can all resonate with that as we've been doing these word clouds over the past month at major meetings with health professionals, with local community folks. What you're typing in is exactly how a lot of people are feeling. And I think that, and I think and I hope that what I share with you today is a source of encouragement about what actually can be done. I'm going to move to my slide deck, And Lori, just tell me, can you see a full screen of the School of Public Health on the screen right now?
Yep, we can see it, Dr. Thomas.
Okay, here we go. And every now and then I'll check in with you because, again, cyberspace, you never know. I could be talking to myself. So I'm so pleased to announce that just this week we released our report, Recovering from COVID-19 in Prince George's County, Maryland. I think many of the lessons that we've learned here have application for the state, including St. Mary's, where you're located. And I highly encourage you to visit our website, and I can make sure that the organizers have access to this report that urges urgent recommendations to inform the ongoing response to COVID-19 and increasing health equity in a majority minority county. You're down in a rural county. Many of the same issues that we face here, you're facing right there in St. Mary's. So you can see the 4 major recommendations, and maybe in the discussion period, we can go into some of the detail. It's a way forward given to us by the voices of the very people suffering. And so part of what I want to talk with you today about is the context within these health disparities. Remember those? Those are the underlying conditions that existed even before COVID. We have to recognize that even after this Delta surge, if we abandon these communities with a lot of the outreach that we've built in to reach them with vaccine, if we abandon them with their chronic diseases, they will see us as simply truly not caring for them. That's the message we're hearing. I want to know what message you're hearing, and that we must keep our eye focused on the ultimate aim, which is to uncover the social, cultural, and environmental factors beyond the biomedical model and address a broad range of issues, including breaking the cycle of poverty. As you can see, a lot of this legislation being discussed is all about providing better safety net, helping ensure that people don't fall through the cracks of our society. And COVID has definitely exposed those cracks. How do we increase access to quality health care? How do we eliminate environmental hazards in homes and neighborhoods? And how might we implement effective prevention programs that are actually tailored to community need? Now, this photo here has the kind of the iconography of the civil rights movement. That image could be changed with many of our Latinx communities that have their own history of struggle in this society, or Native Americans and other groups. Any marginalized group has a story to tell that is associated with these health disparities and social determinants of health. And so and so because of time, I'm using examples from the African American experience. And in this image here is the presidential apology for the syphilis study done at Tuskegee. Now, the reason I bring this up is because if you read any of the news, when it comes to issues of distrust, the Tuskegee study is referenced all the time in the Black community. And so it is very important. And I'm hoping and expect that many of your audience, the audience I'm speaking to, learned about this during their high school, maybe, or college days. I'm interested to see when you learned about it. I'm so old. I remember when it wasn't even part of the curriculum. But the Tuskegee syphilis study is the longest non-therapeutic experiment on humans in the history of medicine and public health. 1932 to 1972, 40 years. But it wasn't until 1997 that there was a formal apology. And as you can see here, President Bill Clinton is embracing Mr. Herman Shaw, one of the survivors. He's in his early 90s. There were only 8 survivors left at this in 1997. But I think what the president said here is important. The people who ran the study at Tuskegee diminished the stature of man by abandoning the most basic ethical precepts. They forgot their pledge to heal and repair. They had the power to heal the survivors and all the others, and they did not. Today, all we can do is apologize. Now, that's from a president who wasn't even alive in 1932. An apology means I'm sorry. I think what we need to do is move towards atonement, which means making things better. And back during the time of the Tuskegee study, I think it's important to realize that you see in the upper right corner, that was an editorial cartoon that ran in July of 1972. It was journalism that broke the story. It wasn't our medical ethics. It was the journalists. And on the front pages of the newspapers in July of 72, when this editorial cartoon ran, that study was still going on. It literally stopped when it hit the front pages of the news. But I want to bring your attention to the sign, Secret Tuskegee Study. It was never a secret. But the people in the study couldn't read. They didn't read the medical journals where their research findings were being reported. The information that the government scientists collected was designed to manipulate the men to consent to autopsy. So there are a number of things to unpack here that have implications for the moment we're in right now, both in terms of health disparities and in terms of vaccine hesitancy. And so I'm excited to say that we have a program that I think is a source of encouragement, at least for me, to recognize that barbershops and beauty salons can be a game changer. Over the past 15 years, my team has been trying to understand what role barbershops and beauty salons can play in addressing health disparities. And then the pandemic hit. And we were initially focused on colorectal cancer screening. And I'm convinced if I can talk to you about colonoscopies, I can talk to you about almost anything. And the pandemic hit, and we were able to make a pivot to bring COVID vaccine information into the community in a trusted setting to help overcome the conspiracy theories and the vaccine hesitancy in the community. And on May 17th of earlier this year, we were able to transform a barbershop into a COVID vaccine clinic, needles and arms. And I'd love to be able to take you into one of those shops so that you can see firsthand what it looks like. But before I do that, I'm going to, okay, Lori, do you think I can take them into the barbershop with a short video?
It's
I'm going to give it a try, and then you'll give me a thumbs up.
okay.
Okay. Here's the first thing I'm going to do. I'm going to take you into the salon. I want you to see. I want you to see what happened when we brought a vaccine clinic to a beauty salon in Capitol Heights, Maryland. And I want you to meet Katrina Randolph and her studio salon called Tray Shades. Okay, just say yes if you see a full screen with chairs. I'm trying to get a verbal yes.
Yep, we can see it.
Okay, maybe some kind of delay. Okay, here we go.
Welcome to Shots at the Shop, and today we're at Katrina's Tray Shades Hair Studio in Capitol Heights, Maryland, which has been amazing.
My favorite part is saving lives, seeing people get vaccinated, because a lot of people are hesitant to get vaccinated. So if I can advocate and encourage them, I'm excited to do so.
A lot of people just don't trust the system. So we have to take the time to answer their questions. And what better place to do that than in a place they already trust?
They can dispel some myths and misinformation that's out there, and then they can refer them to others with more specific questions.
I've honestly seen about 25 to 30 of my clients go from, no, I'm not getting that vaccine, to sure, I'll get vaccinated or show up at your clinic on Monday.
I got my vaccination. Well, I was comfortable coming here. I actually feel comfortable here than I would at a normal clinic. I like it because I know this place is not like It's not strange or anything.
You truly are, barbers and stylists, a trusted voice in the community. And we want to tap into your expertise and be a good community partner.
It's just for us to be knowledgeable in these health disparities so that we can have conversations behind our chair, because I believe that we're more than just a hairstylist. We're touching people just like doctors and nurses do.
Any barbershop that wants to hold a vaccine clinic in their place of business will find you a clinical partner.
So we can bring in all the clinical expertise.
I say just do it. Just work on saving lives. Keep advocating for the community, bringing more people in. And I do believe that having a vaccine clinic at a salon is well worth it.
It worked here at Trey Shades, and it could work in your barbershop or beauty salon as well.
Yes, you're fully vaccinated.
It was a great day.
Okay. Now I'm going to switch back to my slides and give me a verbal. Am I back to the slides, and could you hear that video just fine?
Yes, we could. Thank you.
Okay. So imagine what has happened in a relatively short time, and that is that our barbershop salon outreach effort has now been embraced by the White House, and it's called Shots at the Shop. We're enrolling 1,000 shops across the country. Some of them may be right down there in your neck of the woods. We'll find out. And we've launched the Maryland Barbers and Stylists United for Health with support from the State Department of Health. So here's for me, I'm excited because I remember when it was hard to get anybody to return my phone calls, if you know what I mean. And now I've got hospital systems wanting to bring mobile units right to the barbershop parking lot. From the margins to the mainstream, it's an amazing transformation. And I want you to know you have partners out here in these communities, and that the training program that we have set up for the barbers and stylists has been accepted by the state of Maryland. And I've got my first 3 barber stylists certified as community health workers by the state of Maryland. That's amazing. And so I think that here is something that can be sustained. It can be expanded, and it can be an opportunity also to train a new workforce, to give new skills to the existing workforce about how to engage health disparity populations and overcome the distrust that has been so entrenched. Nobody wants to go back to normal, because for far too many communities of color, normal means living sicker and dying younger. And during the Q&A, we'll talk a little bit more about what you're seeing here. And these are 2 of my lead barber stylists, Katrina and Mike. And you just met Katrina. I'm going to introduce you to Mike here in a moment. And they are just so proud of being able to add additional resources to what they do. And I'm so happy to introduce them to you as partners in our effort to promote health and prevent disease. We can go into some of the details about the hair program and the national Shots at the Shop during our discussion. And also, please, as you can see there on the Shots at the Shop, we're working with NACHO. That's your professional organization, the National Association of City County Health Officials. I want you to know, St. Mary's, we also have an online interactive training program for health professionals called Building Trust. And as you can see here are some of the training modules. This is framed around research. It has implications for simply delivering of services. And I'd love to talk to St. Mary's about how this can be adapted for your needs, as increasingly we face addressing some of these cultural issues in delivering our service and in the recovery. We have to think about, how do we recover from COVID in a way that we, number one, still like each other as individuals, but number 2, make our systems even better. So I'm going to take you again into what working outside the box looks like. And give me an idea on how much time I have, because I want to make sure we have time for discussion. Timekeeper.
It's 9:28 and the session ends at 10, Dr. Thomas.
Okay, so you break in or send me a text when I'm up at 10 minutes. Okay. All right. So um, I'm calling for a warp speed on community engagement. Remember, we talked about warp speed when it came to the development of the vaccine, and how it was scientifically sound. No corners were cut. They just removed the bureaucratic red tape. They provided resources to the pharmaceutical companies even before they had a product. They provided resources to them to have a market. And so we have a life-saving vaccine in record time. But the fact that we can't get it into the arms of all the American people who are eligible is indeed why we're talking right now. And in some ways, it's something we should be alarmed about, that we can come up with a life-saving vaccine, but the challenge of getting it into the arms of our most vulnerable has been a concern. The numbers right now are looking like before we had a vaccine. How is that possible? And so our work here we call fourth generation disparities research. This is our approach to rapidly deploying interventions that we build upon what we know. That's the detection phase, that we build upon what we understand. Yes, we understand that many of these communities don't have access to the internet the way we thought they would, or are marinating in misinformation. The third generation provides solutions, community outreach, meeting people where they are, treating people with dignity and respect. We know that can work. And even the mandates. Let's have a robust discussion about these mandates. Mandates work. And fourth generation, it's time to take action, but to take action within the context of health equity, recognizing these structural determinants of health, and the pervasive issue of race must be addressed. And so I'm going to take you into another location. Now I'm going to take you into the barbershop so you can see what that looks like, and the wicked problems that COVID has presented us with, which is why sometimes we find people that we would think are on the same side arguing with one another. This is a complex, wicked problem, and we need to find out how we can find a way forward. And so I'm going to take you into an amazing place and hopefully give you a sense of the new partners that you have on the front line. And I'm going to assume that it was working the way it did the last time, and you can see a full screen and you're going to be able to hear what comes next. Here we go.
The barbershop is a sacred space for the kinds of conversations we need to have to move people from vaccine hesitancy to vaccine confidence.
Well, when Dr. T first came to me, he made me realize that we are more than just barbers because of the relationships that we have with our clients. Getting the right information to them from behind my chair is a definite way of giving back, is helping the community.
Mike sent me a flyer. He said, "Hey, Dr. T, this is information being distributed in our communities." And the flyer said, "COVID's a hoax. Don't take the vaccine." Our communities were marinating in misinformation.
I tell them, I can understand your concern. Don't disarm yourself. Do your research and make a decision that's going to benefit the well-being of your family and the other loved ones around you.
And on May 17th, in Mike's shop, we did the first barbershop vaccine clinic, needles and arms, anywhere in the state of Maryland.
It was just awesome to see the people coming in and rolling up their sleeve and taking the position to be vaccinated. I was excited.
And now I think the barbershop and the salon in the Black community is recognized as a legitimate place for engaging the population in health promotion and disease prevention. So I've been ecstatic. And if you can give a life-saving injection of a vaccine in the barbershop, why can't we give the flu shot there? Why can't we give the diabetes test there? Why can't we do tele-wellness there? That's the vision.
All right. Why can't we do telewellness there? And so this is a question in terms of where we go next. Can we take these lessons from the pandemic and bring them forward in a way that we can actually have a better system, better relationships with our community partners, and new venues to actually deliver care. And so again, before the pandemic, we were focused on colon cancer. And like I said, if I can talk to you about a colonoscopy, I probably talk to you about anything. And the pivot to COVID has even made our relationship with the community even stronger. Now, as I head to the finish line, I wanted you to see again. I don't see the audience, so I have no idea of the extent to which this audience goes to ethnic barbershops and beauty salons. But all I can say is no self-respecting black barber or stylist would ever say, I'll get you in and out in 15 minutes, okay? It's an all-day affair. It's a community fair. It's a gathering of entire families come to these venues. And you can see there on the left, we're working with a local artist, not a local artist, we're working with an artist to produce a graphic novel format for COVID education, outreach, and mitigation. Again, bringing in different styles, different ways of communicating with the audience, demystifying the medicalese and the clinical environments that make people somewhat nervous. And by being able to help people in the community and keeping them out of the hospital because of Maryland's global budget model, that is something that we can actually build upon, that we have policies here in the state of Maryland that actually incentivize community outreach and engagement. And so recently, we took our show on the road to the African American Cultural Festival. And I just want you to know and see that we can also, here's Mike and Katrina again, that we can bring the barbershop on location, pop-up barbershop along with the pop-up clinic. And as you can see here in some of these images, we had the barbershop and the public health education information on one side of the health pavilion tent, and literally 10 feet away, you could get in line, register, and get your COVID vaccine. As you can see here on this board, we asked people, what was your motivation for getting vaccinated? What was your motivation for getting vaccinated? Now think about what you're about to see and think about what you're hearing. Here again, just some scenes as people were getting their hair done before they went over to get a vaccine injection. Here was the first bucket, my friends, family. This is the motivation for why people got vaccinated that day. I want to see my stepmother. My mother told me, a whole lot of moms here, so I could hug my mom. For my family to be safe. Family was the first big bucket. The second bucket was to stay safe. I don't want to get sick. I don't want to die. I want peace of mind. I don't want to get COVID. So personal safety. First, my family. Second, personal safety. And not necessarily in that order. These buckets can be rearranged. But third, keep my community safe. They have a public health frame of mind. They have a public good frame of mind. Here's my question for you. If these are the motivations for people of color, in this case, African Americans, to get vaccinated, how many communication material, how much communication material, how many videos, how many things have you seen for distribution to the community, these minority communities that have these themes in them? Community safety, individual safety, keep my family safe. Think about that. And here's where I believe that the community is telling us a way forward. The question is, are we listening and are we translating our communication and educational outreach into the culturally tailored themes that the community is telling us that will move them from vaccine hesitancy to vaccine confidence? And so I'm going to take you to one more place to see how this is all framed in the context of health equity. And then we're going to open up for discussion. And this is my last attempt to see how the technology works. And I'm going to assume that that StreamYard is working indeed. And so I'm going to go to full screen here. This will be our last one. And then we're going to open up for discussion. Here we go.
Stephen Thomas. I'm a professor in the Department of Health Policy and Management at the University of Maryland School of Public Health, where I direct the Maryland Center for Health Equity. For the past 15 years, we've been conducting research on the role of barbershops and beauty salons in addressing chronic disease, preventable diseases in the African American community. The program is called HAIR, Health Advocates in Reach and Research, reaching within the barber stylist community to train them, to get them to a point where they can become certified community health workers, and research to help actually improve attitudes and beliefs towards participation in biomedical clinical trials. And we've been working to make sure that the barbershops and salons could actually be transformed into COVID vaccination sites. And we've been able to successfully, literally deliver vaccines into the arms of people who otherwise would not be vaccinated. There are 3 takeaways from our experience so far. Number 1, misinformation is real. We've got a real problem on our hands. And that problem can be solved by making sure that settings like barbershops and beauty salons are not super spreaders of conspiracy theories, that they're actually places where you can get accurate information, clinical services, and most importantly, an opportunity to rebuild a relationship between minority communities and healthcare delivery systems. Number 2, meet people where they are. You have to listen to their concerns. Hesitancy does not mean never. By listening to their concerns, treating them with dignity and respect, we can move them from hesitancy to vaccine confidence. And thirdly, trust matters. It's not just the message, but it's also the messenger. Barbers and stylists are highly trusted people, and they're trustworthy. By having them as partners in this effort, we can really move the needle and save lives. And we believe as people get information and the knowledge they need, they will naturally gravitate towards saving their own lives and the lives of their family and loved ones. And at the end of the day, that's what this is all about, protecting people, one by one. In our case, in the barber and salon chair.
Yes, sir, you're fully vaccinated.
All right, all right. Let's hope that we've got a nice bow on things for our discussion. And I'm going to come out of the share mode. Let's see if I say stop sharing. Okay, stop screen. Do I need to click on stop screen?
I don't think so. I think we're good, Dr. Thomas.
Okay, I don't want to hit a button that ejects me. Well, let's open this up and hear what this audience is thinking here. Let's get some feedback and discussion. I don't know how that works in this StreamYard, but I will say this: I love that the transitions. I'm kind of liking StreamYard.
Perfect.
I want to see that audience. So I'm gonna turn it over to you. Let's bring that audience in.
Perfect. So I'll actually be able to populate the question right onto this screen there. So if you have a question for Dr. Thomas, feel free to put it into the comment section on Facebook or YouTube, whichever platform you're viewing on right now. And we did have our first question come in from Christine Allred. And the question was that, are the modules self-paced or is it a weekly program? And is there a link that we can check out?
Well, it's very good. The couple things. Self-paced, yes. So we have the training modules, and we did this in partnership with NACHO on the Maryland Barbers and Stylists United for Health. Those are available like on a YouTube stream. And I'll make sure that you organizers have this. And interesting enough, if you point your camera to that QR code, it will take you to the landing page. I'll make sure you have the link. I get a chance here, I'll put that link right in the chat. So those modules are available and accessible. So that's number one. And then the self-paced, absolutely. But every Thursday, we do a town hall. We convene the barbers and stylists and health professionals to hear about what's happening across the country, to hear about best practices. And it's amazing what some of your sister health systems and health departments are doing around the country. Maryland is the model, though, and I want you to know that what we're doing here in this state can help the rest of the country. And there's more to come. So what we'll do is kind of get connected, and you'll help me stay connected with my my new St. Mary's friends, and bring you into the fold, and the shops and community partners, your local churches and others, bring them into the fold. If we work together here, I think we can even make it better.
Perfect. Thank you, Dr. Thomas. And we will make sure to get that link sent out to all of our participants once you send it over to us. And then it looks like our next question came through from Lynn Mejia. And the question was, what does the acronym HAIR stand for?
That's very good. Hold on. And if I said, let me see if I can find that link for them.
Multitasking.
Yeah, you can always tell. Their eyes are up in the corner. They're doing something else. HAIR, Health Advocates in Reach and Research. Health Advocates in Reach and Research. And that reaching within is to train the barbers and stylists to stay healthy themselves. They're really role models. And in the context of COVID, they were role models in how to mitigate, wearing masks, sanitizing. But research, this is also an effort to increase the diversity of participants in clinical trials. That's how we learn. That's how the science progresses. And you know what's interesting, Lynn, is that for the vaccines that we have today that are FDA approved, they all met the targets of diversifying their study samples so that the results were generalized for African Americans and Hispanics. That is remarkable because there's so many other conditions where we don't have sufficient numbers of minorities in order to make scientific inferences. So HAIR, it was the start. And now we have Maryland Barbers and Stylists United for Health using the HAIR model. And we have the White House Shots at the Shop using the HAIR model all across the country.
Perfect. Thank you. Lynn says awesome. Next question came through from Samaria. And her question is, in these outreach efforts, have you had partnerships with social workers in the communities?
You know, I love social workers. My sister's a social worker. My wife has a social work background. And we work with our colleagues from the University of Maryland Department of Family Science that does marriage and family counseling. I think social workers are a key to knitting people together with systems that have been fragmented. If the pandemic has done anything, it has exposed the siloed and firewalls we have between our different programs. Even the money is in buckets. Here's a diabetes pot. Here's a cardiovascular disease pot. Here's a mental health pot. And as if these things aren't connected in the people that we're trying to address. COVID has exposed that problem. How do we make sure we don't go back to our corners? In many places, they form coalitions that have people who had not been at the same table before, now at the same table. As the surge starts to relent, folks are starting to wanting to migrate back to, business as usual. Let's not let that happen in St. Mary's County. Let's not let that happen right here in the state of Maryland. We need to keep these new structures in place because this is not going away. We're not going to have to wait 100 years before we're faced with a pandemic. And once this becomes endemic, what's that mean? It means that it's not going to go away. And the implications of that are serious. This is not the flu. The flu doesn't have a side effect of causing type 2 diabetes and all the other things we're seeing with this disease. So you don't want to get COVID. And we need all the help we can get. And if that means being outside the box in a barbershop or beauty salon, then that's where we should be.
Perfect. Thank you, Dr. Thomas. We don't have any other questions in right now. There is a little bit of a delay coming through from the streams. So if anybody has another question, feel free to comment that right now. We'll just give it a couple seconds here.
And what I'll do here is I'm going to drop a link. I'm going to drop a link into the chat. And then I want you to tell me if, if your colleagues can get to it. Hold on here. go.umd.edu. Now, /MDBSUH. I want the two of you to talk to me. You know your audience, and you know what they're facing. You saw the words in the cloud. I'd like to hear from the two of you about your audience before we have to leave.
So the audience, so the membership of the Healthy St. Mary's Partnership?
No, I want to hear from Lori.
Oh.
And I want to hear, you're the only two in my Hollywood squares I can talk to, and the audience is listening to us. So tell me about your audience and how you think they are responding to what they just heard this morning.
So, Dr. Thomas, you know that, I'm a big proponent of what you're doing with the barbershops. We actually piloted something similar with our Health Enterprise Zone project years ago here in St. Mary's. And so I think it is something that we really should look at again as to, meeting people where they are. That's what really public health and our work in the community is all about. As we strive to make our community healthier, as we strive to connect people to services, as we strive to make sure everyone has a medical home. So I think the audience, here today are all folks that are invested in the health of St. Mary's County from whatever lens they view that. So I think this kind of work is very exciting and opens people's minds to what's possible.
Okay. And what I want to say to them, because sometimes I have people say, oh, I know where a barbershop is right around the corner. This is not a cold call kind of thing. Right. You don't just drop in. I'd love to bring you all on board so that we systematically bring on shops there in St. Mary's County. And here's a question for you, and that is this: could there be an arrangement where I know that every other month there's going to be a mobile unit or a team from St. Mary's County in this salon or in this shop doing X, and I can count on it and put it on the calendar? Is that possible? What are the barriers that would prevent us from doing that? Or maybe I should say it like this: how might we have a routine engagement using these venues as a way of bringing services, gathering information, both screening information, but also hearing from the constituents about what they're going through to, in a sense, follow the doctor's orders. The way this whole thing started was watching someone come into the barbershop who'd been hospitalized, actually emergency room, heart attack, hospitalized, and pulling out his pills that he said he's going to have to take for the rest of his life. You all know about this for the hypertension meds. And the barber said, hey, Joe, if you take those pills, you won't be able to keep up your obligations. Now, Lori, do I have to explain that to your audience? Do I have to translate that into plain language?
We'll assume that folks got what you were.
So erectile dysfunction is a serious side effect of some of these medications. But when the barber said that, and I saw that man's face, I said, he's not going to take those pills. And his doctor has no idea there's somebody in the community with that kind of influence. Now, what if there are partners and they say, Joe, if you're having side effects, tell your doctor. Don't be ashamed. There are ways that we can help improve care coordination in the community. And COVID has forced us to get out of our boxes into the community in ways that we may not have been in a robust way. And I think the key is don't let it go away. Here's what the community is saying to me. They said, Dr. Thomas, I remember when they wouldn't even answer your phone calls. Now they want to bring mobile units here and do all kinds of things. Who's this for? Is it for us or is it for them? I thought that was interesting. And it translated into this. Is it for us or is it for them? If it's for them, they'll come give us the jab and leave us with cancer and hypertension and diabetes because you can't spread those through the air. So they just want us to be able to come out and shop and spend money, but they don't really care about us. I thought that was interesting. But if we stay and address those underlying health conditions that were there before COVID, I think that we can have a brand new relationship with these communities and improve our care coordination. And because of Maryland's model, literally be incentivized to do it. And I want to know what your audience out there thinks about what we can do, because you know how short our memory is. Don't you remember that moment we were in when we thought we were home free, throwing away masks before Delta? Remember that? We were spiking the ball in the 30-yard line. So that's how fast we as a culture can forget. Delta is telling us, don't forget.
Right.
And the community is telling us, don't abandon them. And I would love to have St. Mary's in the fold as we move forward with a new model for delivering care to our most vulnerable citizens.
So I'll speak as the co-chair of the Healthy St. Mary's Partnership, that I believe that, you know, one or multiple of our action teams would actually be very interested in working with you and seeing what is possible in St. Mary's County. So we will absolutely follow up with you after this day that we have together, where we're learning and growing as a community. So thank you so much, Dr. Thomas.
It's been an honor and a pleasure. I'm so glad I've got a new technological StreamYard. So tell the tech people this works. I was able to go back and forth without coming in and going out. And I hope it's not the last time we meet. And I'm looking forward to meeting you in person.
Thank you so much, Dr. Thomas.
So everyone, this concludes this session. We hope that you're going to join us at 10 for the Navy efforts regarding per and word I can't say, substances, PFASs at the Naval Air Station Pax River and Webster Outlying Field. So please click on that link at 10 o'clock and join us for the next session. And again, thank you so much, Dr. Thomas. As always, it was a joy to listen to you and to hear the amazing things you're doing for the state of Maryland.
Thank you, Lori. And can I hang out for the next session? Do I need to click on anything? What do I do?
We can get you the agenda, sir, so you can listen and join us for the rest of the day if you choose.
Sure. So I'll look for that in email.
Yep, I'll email it over to you now.
Okay. Hey, make it a great day. And everybody out there in cyberspace, it was a pleasure being with you. Don't play with Delta. Keep your mask close. Stay away from crowds. Bye-bye.
Bye, Dr. Thomas.